We are hearing news stories from so many people about their ongoing fight with the COVID virus. Those still suffering the after effects are called long haulers, and some say the lingering symptoms are more debilitating than the original infection. For one nurse, the after effects of COVID were so bad they forced her to retire. Only News 4's Emma Hogue talks to the long hauler who's now calling it quits.
I'm incredibly sad about that. I mean, I think it's the right thing to do. It's the right thing for me, and it's the right thing for my patients, because the way I am right now, I'm not 100%.
It's one of the toughest decisions she's made, but Michelle Wilson says long-haul COVID gave her no choice but to retire early from her job as a nurse at Barnes Jewish Hospital.
I was having palpitations and arrhythmias and such shortness of breath, it actually felt like I was running on a treadmill, just walking around the bed of my patient.
Wilson contracted a mild case of COVID in November, recovered, and tried heading back to work. But shortness of breath and fatigue put her in the hospital on oxygen for 3 days.
It's not a fun thing to be on the other side, I discovered. I'm somebody who's never really been sick all my life. You know, I've been very active. I work 12-hour shifts. I bike, and I've just had a very active lifestyle.
It wasn't her actual stint with COVID, Wilson says, was difficult, but the brain fog, intense migraines, heart palpitations, and fatigue that 9 months later still won't go away.
I want people to understand that this isn't the flu.
Some of the conditions are severe and linger for a long time, and they're debilitating.
Dr. Zayad Al-Ali with Washington University says even those with mild COVID cases can have long-haul symptoms that are far worse, lasting weeks and even months. After effects that can sideline anyone, young, old, and even those who are healthy.
It spans the gamut. It's really not one thing. It's not only fatigue. It's not only brain fog. Some people are having, new onset diabetes, heart attack, inflammation of the heart muscles, strokes, blood clots, et cetera.
With no cure and few treatment options, Dr. Al-Ali says the strongest line of defense is a vaccine. Although Wilson is retiring from nursing, she's starting a new project, a COVID long-haul support group to share resources and help others cope with their symptoms.
Just have somebody who actually understands what you're going through.
Some people who are young and healthy may not want to get the vaccine because they don't think the virus will be deadly. Well, doctors say these long-haul symptoms don't discriminate against anyone, and in some cases can be worse than the initial infection. Even more reason to get your vaccine. Reporting in Forest Park tonight, Emma Hogue, News 4.